old female from Greenbrier County. Now get this one, and this is terrible. It's really sad. The 6,753rd death is a 26-year-old male from Kanawha County. The 6,754th death is a 73-year-old female from Wood County, and the 6,755th death is an 86-year-old female from Ohio County. Now, really and truly, whether you be 26 or 86, we hate it. We hate it so badly that we've lost wisdom, we've lost youth, we've lost loved ones of great families of West Virginia. And so please remember all these folks. Please remember them all in your prayers. Our active cases in West Virginia are 321. Our new daily positive cases are 128. Our daily positivity rate is at 2.67, and our cumulative rate continues to fall. It's at 8.17. Recovered cases in West Virginia, 491,000 and plus. 101 people are hospitalized in West Virginia with this dreaded killer. 34 in the ICU units and 16 are on ventilators. We have all the map in the state green except the county of Worked, and it's in gold right now. I offer up over and over and over how important it is for you to get your booster shots. It is unbelievably important. I was just doing a little documentary or whatever with Johns Hopkins, and Johns Hopkins was down, and they were doing this all across the country and everything. It is unflat believable how little risk there is to taking the vaccine, and the benefits are off the chart. You could still very well get COVID, but the likelihood of you going to the hospital is really low, and the likelihood of, God forbid, death is almost nil. It is so, so important that you get these vaccinations, and it is even more important, in my view, to get your booster shots. The numbers continue to get a little bit better. You know, from the standpoint of the 65 and olders, we're at 90.4%. We've gone up from 90.3. We keep getting little bit by little bit better, and we'll take it. We'd like it to be a whole lot more, but we'll take it. All the information on my COVID vaccine info line is up, and all the free testing you should take advantage of. We have 30 outbreaks in our long-term care facilities now. We have no outbreaks in our church community, and we have 4 inmate cases and 2 staff cases in all corrections today. Those people deserve a lot of kudos. They've done a good job. Okay, the rental assistance program is still out there for you. It's for the landlords as well, with permission from, the renters, but these are dollars that we can get to you, and I'll be reading you some successes about some more stuff in just a second. But the new homeowner assistance program is up and going right now, and as I've said many times, you can get up to $15,000 of mortgage payments that are past due that you can catch up, and past due utilities up to $2,500, and past due insurance and property taxes, and other housing costs of up to $5,000. Take advantage, West Virginia. Take advantage of these federal dollars. We don't want to send them back. We want them right here in the state of West Virginia, and we're going to make things better. And to the people that are really hurting, we hope in every way we can make things better for these people first and foremost. I remind you about giving blood. I couldn't say it more profound. First and foremost, your physician needs to, chime in on this and agree that it's a good thing for you to do, or it's a permissible thing for you to do. Beyond that, it's your decision. We absolutely need the blood. Red Cross is absolutely standing ready to go, and we need the blood. From the standpoint of the Jump Start program, you remember I told you about 2 ladies at a drive-through window. They were so proud to be back to work. I mean, that's what this is really all about. They really probably had a feeling of hopelessness, but now they're back on the job. They're back to work. We need them. Our small businesses need them so badly, it's unbelievable. And this incentive program that we copied off of Oklahoma, really and truly $1,500 if they're back to work and on a job and qualify for 8 weeks of work, and then beyond that, they're off and going. Now get this number. Since we launched this thing in January, 14,685 West Virginians have applied for this right here, this Jump Start program, this Job Jump Start program. 14,685 West Virginians have applied, and 12,533 have been approved to participate in the program. Now you just think about it. Our unemployment numbers are so low, it's off the chart. But we've just got 12,533 more West Virginians back into the workforce by doing this little nothing program. Absolutely, it's good stuff. Real success, real success. The new vaccine calculator, WVU, Dr. Marsh, we thank them over and over for all that. You know, the second booster is now approved by the CDC for 50 and older, and that are out, for the time period, whatever it may be, for Moderna and Pfizer and J&J, 4 months, and with J&J, I think it's even a shorter period than that. But not getting this booster shot is a really bad move. If you're fully vaccinated and you're out past your time period, your window from your last booster shot, and not getting this shot right here, bad move. Really, really bad move, because you got to give in to the science and believe that the science is telling us if you're 4 months out, your last booster shot's not doing you much good. If you want to take a chance, go into the death lottery and have the spin of the wheel, and it could be you. I think Saturday, Kathy got her second dose, her second booster, as soon as it was available. I've gotten mine. Without any question, you need to absolutely get this done. Like I said a minute ago, we had some bill signings, some ceremonial signings of bills. House Bill 4276, gave us the registry possibilities in state of West Virginia. We were one of the first, if not the first, states from Appalachia that have stepped up to do this. One of the top 3 or 4 or 5 in the country that's doing this. Dr. Ali Renaz is doing phenomenal work and everything. We had, we had a representative there from the Michael J. Fox Foundation, unbelievable work that they're doing. George Manahan, is absolutely just a superstar beyond belief, and committed absolutely to doing everything we possibly can to some way, somehow stop this dreaded killer. So we try. We come up with things and we try. From the standpoint of our legislature, I commend them. They brought me the bill. I gladly signed it, and West Virginia is now on its way to trying to be the little state that everybody threw a lot of mud at forever, but the little state that may very well be the first state in the country to come up with a real cure for this incredible killer. And I also went through another ceremonial bill signing. It was House Bill 4497, and this basically extends the current West Virginia jail per diem rate through June 30th of 2023. Good stuff. Our counties, work so hard and everything. Our jail system is good. We need to support, and we had 2 great gentlemen there supporting and right with me this morning. Last thing I have today is just this. And I found out about this really and truly just driving down the road, and was stopped along the way, and a lady came up. In fact, I'm sorry, it was a gentleman that came up and told me about a deputy that this had just happened. But a deputy in Wyoming County, his name is Tyler Phillips. He was running to the fire, just exactly what all these incredible folks do all the time. You know, there was an SUV that was stuck in the ditch, and he was running to the fire to help them. And in helping them, there was a truck that was pulling the SUV out, and some way, somehow, something happened. The truck maybe slid or whatever it was, and all of a sudden, this gentleman was pinned between a tree and the truck, and has a catastrophic leg injury. You know, he's going to survive, but it's going to take a long time. And we should absolutely always know just how important and essential these great people are. They always run to the fire, don't they? They're always the ones that we call when we're in trouble. They're always the ones that step up. Tyler needs your prayers right now. And we hope and pray that he'll get through this, and we should absolutely all know that without any question, Tyler should feel that we're with him. We haven't just forgot him. We don't just take him for granted. We absolutely know just how great he is and all of his comrades that do the great work in Wyoming County or throughout all this state every day. We don't forget. We offer up our prayers. So Tyler, we know you're going to get well, and it's going to take a while and everything. Just absolutely don't push it too much, and we'll know we're right with you. You know, I really appreciate the gentleman that came up to me and was willing to give me this information, but I surely promised him that I would be mentioning it in my briefing, and I would have done that anyway, but I really appreciate the words, and Tyler, just imagine, you know, people coming up to the governor saying, you need to keep in prayer Tyler Phillips, you know, because look what he's done for us. People do love you, and people do really care. So Godspeed, my friend. Get well. Thank you. That's all I got.
All right, thank you, Governor. Today we'll go first to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Just to highlight a couple of things, the governor had pointed out the success of our vaccine calculator. To date, we have had almost 100,000 West Virginians not just go onto the calculator, but actually complete calculations on the calculator, averaging about 5,000 West Virginians a day completing the calculations. And we are seeing those numbers in our boosters, particularly over the age of 50. So we'll continue to keep that available, and we will update it as things potentially change, as Dr. Marsh and Dr. Amjad have talked about, probably another booster shot, particularly for our older West Virginians later this fall or early winter. So we will keep that up as well to make sure that we have that available to make it less confusing for West Virginians to understand when to get vaccinated and the value of vaccinations. And Dr. Marsh, I think, may talk about some of the numbers in our death percentages here later that will reinforce the importance of why we're doing this. In addition to that, as the governor pointed out, 101 in the hospital. The last time we saw those type of numbers in our hospitals was mid-July of last year. So a continuing positive trend for us in West Virginia moving forward. And the last thing I will mention is that booster dose, or actually first dose for those over the age of 18, over the weekend hit 71.9% of our over 18 population has taken some level of vaccination. So we appreciate West Virginians continuing to step up. As the governor said, this is our primary weapon against this terrible disease. Thank you.
Thank you, sir. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. And following up with what the governor has said and what retired Major General Hoyer has said, we know that although our numbers do look very promising and moving in the right direction. We need to keep our guard up. Our RT value today went up. It's 0.97. So remember, anything over 1 means that COVID is spreading. Under 1 means COVID is not. And we know that we are likely undercounting the number of cases based on home testing, et cetera. So that's not said to raise a artificial or dramatic cry for being careful, but I think it is important to recognize that we are not finished with COVID until COVID is finished with us. When we look at the state of West Virginia, Shannon McBee, our lead epidemiology officer, has provided us with the insight that 50% of the deaths from COVID-19 thus far are in West Virginians over 75 years old. 76% of the deaths are in West Virginians over 65 years old, and 95% of the deaths are in West Virginians over 50 years old. As the governor has very correctly pointed out, getting fully vaccinated and boosted is really critical, particularly for the Omicron variant of COVID-19, which is now our most common variant in our country. We are still not seeing that as the dominant in West Virginia yet, but it will be most certainly. And as we go forward, we have seen, say, for instance, in Washington, D.C., where lots of people are transmitting this variant to each other because it transmits much more rapidly than any other variant we've seen to date. So really important to, as General Hoyer said, get your vaccines, get your boosters if you are eligible, and that's what's so great about the vaccine calculator. Then you may well be eligible for a 4th dose, a second booster, which is important in reducing your risk of getting COVID, but importantly, reducing your risk of getting sick from COVID or dying from COVID, particularly the Omicron variant. And we see countries like China that are now really under fire because they have not vaccinated their elders to the same level as we are doing in West Virginia. And we know that the best strategy for preventing deaths, as the governor reads every name before every press brief, is to have people fully vaccinated and boosted. So going forward, we are very optimistic that as we are able to see our elder population get vaccinated and boosted, and the appropriate population get boosted with the second booster dose 4 months after the first one, we will continue to see deaths be low in West Virginia, hospitalizations be low, and that is really good news for all of us. Thank you.
All right, thank you, Dr. Marsh. Dr. Amjad, our State Health Officer, and Secretary Bill Crouch are both joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Amanda Barron with Nexstar Media.
Hi, everybody. Amanda Barron from 13 News. Hope you're all doing well. I wanted to talk about the departure of Jeremiah Samples from the DHHR, the deputy director. And I know it's a personnel issue. I understand that. But my question is, he released a statement today talking about some of his concerns. He seems to have bipartisan support from lawmakers. So I wonder if you can tell me a little bit about where the differences are there and whether or not he was fired or he resigned. Thank you.
Amanda, did you direct the question to me or Secretary Crouch?
Whoever would like to take it.
Okay.
Both of you would be great. Thank you.
Okay. Well, let me just say this, that and then Bill, you can chime in on more specifics than I have. But Amanda, at the end of the day, all of us know that there are challenges and issues within DHHR, and they're not new, are they? I mean, really and truly, these have been around for decades and decades and decades, and we try to make things better. There's no question we try to make things better. But to hastily pump out a bill that could really, we could blow our legs off with it. We could have had something, that maybe we would have lost some level of funding, from the federal government that would have, I know I've gotten all kinds of texts after text after text. Now, Amanda, here's the bottom line to the whole thing the way I see it. I'm not going to get into personnel matters with an individual and everything. I'm not going to do that because a lot of those specifics I don't know, and it's really not proper for me to do that. I'm going to thank Jeremiah for his work that he did here, but at the end of the day, the thing that I will do, Amanda, is just this, exactly what I said. I will fix it, and I will absolutely bring in experts to do a review from top to bottom. And then once we find the deficiencies in what we should do, we'll fix it. I mean, that's just all there is to it. And I'll promise you, my secretaries know that I demand really, really good work out of them. Now, in all fairness, and let's just again be brutally fair, and it's just this, is over the last couple of years, sure, there's probably been misses along the way, but over the last couple of years with this pandemic and what we've had to deal with and how we staunched everything up through Dr. Marsh and General Hoyer and Dr. Amjad and all the different things that we've done, there's a lot of kudos that should be passed out. And so any shortcomings that we have, I've never not let the public down, and I'm not going to let them down on this one either. So we're going to do exactly what I've just said. I'm not going to dive into the personnel issues, but Bill, if you got anything to add, feel free to add. But that's just how I feel. I'm going to thank Jeremiah for his work that he did here, and if things didn't work out and everything, that he's an at-will employee, and I expect our secretaries to do their job and to do what they think is in the best interest of all the people in their agency. So, Bill, if you got anything to add, that's up to you.
Yeah, thank you, Governor, and thank you, Amanda. And as you said, Amanda, this is a personnel issue, and it's we're not going to get into the details of this. But as the Governor says often, we all have to pull the rope in the same direction. This is a large agency, and we have to have everybody on board in terms of what we're doing, and we've got to meet the goals out there. So of putting people who are in need, our vulnerable population, making sure that those safety nets are there for them. But I'm in complete agreement with the Governor. I have been since day one with regard to hiring a consultant to look at the department top to bottom. There have been comments made that in terms of providing information to the legislature, we have always provided information to the legislature and always will. We're an open agency. So we are not only in complete agreement with the Governor, but if the decision is to split the department, I will make sure that happens, and I'll make sure that happens in the best way possible for the citizens of West Virginia. So, again, we support the Governor. I'm part of the executive branch. The Governor's been right on target with regard to what we need to do from day one in this. So we're going to continue this effort, and we're going to get a review, and we're going to look at those results and see what needs to be done. So, thank you.
All right, thank you, Amanda. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask again about the plans for keeping our state-run COVID testing sites open. I think it was on Friday that Dr. Amjad said that our testing has fallen off by at least half, in the last month. So I was just wondering, what the plans were to keep those open going forward. Thank you.
General, maybe you could do this one.
Governor, maybe I'll start and go to Dr. Amjad. Charles, with the changes in volume, there's a lot of work going on within the task force and DHHR to maintain steady state. We know we still have a number of organizations such as FQHCs, our pharmacies, and other facilities that are keeping testing available when needed, particularly for PCR tests. But we also know that most West Virginians, like most Americans, are now going to home testing to be able to stay abreast of potential challenges. So we continue to work that. Right now, we believe with pharmacies FQHCs and other entities available, we have plenty of volume available. But I'll turn it to you for any additional comments.
Thank you. But the only thing to add to what General Hoyer said, Charles, is that we encourage people to still go and get tested, if either at the FQHCs, the pharmacies, or at-home testing. Our numbers have decreased throughout the state, and we're still going to find ways to make it available. But right now, there are home tests that you can order through the federal government or visit one of the locations that General Hoyer did mention. But we do want to remind people to go get tested, either one of those locations or see your doctor as soon as possible. Thanks.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel and fellow journalists. I want to follow up on General Hoyer and Dr. Marsh and the comments about the elderly, and in specific, the nursing home residents. I know you were early on, Governor, in getting shots to those in the nursing home. With the second booster coming out now, I'd like to know, how far along are we in getting them their fourth booster? How long does it take to cover the state of West Virginia in a second booster shot? Thank you.
General, you got to go, sir.
Yes, sir, Governor. So, Paul, I don't have an exact percentage for you right now, but we will look at getting that for the next press briefing. But what we can tell you is that early on, this started in our nursing homes and assisted living facilities, with facilities identifying those who were specifically immunocompromised within, which is a large portion of the individuals in those facilities. And now we've transitioned into the broader, just general fourth dose, or that second booster dose. We at the Interagency Task Force with DHHR work directly daily with the folks who manage that effort, Marty Wright and the Healthcare Association group. And there is a ongoing effort going on with pharmacies and other entities that we've used to get that population fully to their fourth dose. But I'll get you a percentage for that for the next event.
All right, thanks, Paul. Governor, I'll turn it back to you.
Well, one thing that I'll follow up on, Paul, because you make a good point, and and I would just say this for, Dr. Marsh, Dr. Amjad, General Hoyer, and Secretary Crouch while we're on here, but if we can make a stronger effort with all across our nursing homes to get them their fourth dose and get it to them really, really, really quickly, we want to do that. And I know we're already doing that, but if that needs to be pushed in a bigger way, I am supportive 1,000%. And Paul, I appreciate you bringing it more to our attention. But the faster we can get those folks, that are where their time is for the 4-month period or 2-month period or whatever J&J requires, but the faster that we can get them that fourth booster shot, the more lives we'll save. And so let's all as a team go to work on that and work a little harder on that. And if anything you need from me, from a standpoint of our team, I stand ready to help anyway. From that, really the only other thing that I have is, you see the situation that's going on today in China. You see, basically China is getting ready to almost shut down, and the reason for that is just like Dr. Marsh said. They dropped the ball. They didn't get their people vaccinated as well as they should. And now they got a real problem, don't they? Of all places, we heard of all the accolades, how great China was doing and all that kind of stuff. Now, we really still believe that this all originated in China. the problem originated there. But we found out, oh, they're doing so good in so many things, and now they're awakening to the fact that they may very well have to shut down big sections of their country and everything in regard to the fact that this is out of control because they didn't do a very good job getting their folks vaccinated. Well, we continue to try in every way in West Virginia. We continue to make successes, and I ask you so many times because it just tears my heart to pieces that we've lost a 26-year-old, in the last few days. But it also tears my heart to pieces that we've lost 6,755 people. That's what it's really all about. So keep them all in your prayers. Keep Tyler Phillips in your prayers. A great young man that was a first responder in the sheriff's department that was trying to run to the fire and help somebody. So let's just all keep pulling the rope together. We're going to get there. We've still got a ways to go. We don't need to drop our guard. Dr. Marsh said it just perfectly. And if you want my true feelings, I would just say just this. You can't believe that this is over forever. Let's absolutely always beware and be concerned and be continuing to do the prudent good work and everything until it is officially over. And all those, that are, suffering from the dreaded Parkinson's disease and everything, we want you to know we're right with you, and we're trying to do everything and anything we possibly can to help there too. So we congratulate all the folks at WVU and all the folks that are doing great work there. And, it's an incredible state. It's really an incredible state. And we're so, so, so blessed to have the great people we got around us everywhere. Let's just keep pulling the rope. We're going to get there.